My name is Daniel Haslam. I'm a lecturer at the Open University and a member of the Centre for Voluntary Sector Leadership, along with Fidèle, Carol, and other colleagues. Really pleased to be here, really pleased that everyone could attend today. A few points, just reminders before we get into our great speakers for this session. Just a reminder to fill in the polls if you haven't done so. They've been mentioned a few times as we've gone through. You can scroll back up the chat box, I believe, to try and find them. You can also go up to the top menu, click the More button and view the polls there as well. There will be some more coming up later, so keep an eye out for those. But if you've not already done the ones that have been previously presented, please go back and do those. Big thanks to everyone who's been amplifying the conference on Twitter and other social media. Reminder that the Open University Business School Twitter account is at OUB School, and the hashtags we're using are CVSL Conf 2023 and also the hashtag cost of living to try and tie in with wider debates about the cost of living crisis. Okay, I think that's about it for the housekeeping and reminders. Oh, one final thing, reminder to get your questions in for our speakers as we progress along the session. It's really great to get input and queries and questions from our audience, and really useful to have that discussion later on. Also, don't forget we have our open networking session after the presentations are done, after Fidèle's wrapped up. So by all means, hang around for that as well and be able to answer some more questions in that session. Okay, without further ado, we've got two great speakers coming up in this session, and as we've done with the other sessions, I'll introduce them both first, and then hand over one by one. So first up, we've got Maggie Lennon. Maggie is the director and founder of the Bridges programs, which for 21 years has been promoting the social and economic integration of asylum seekers, refugees, and migrants in Scotland. The charity is recognised as an example of best practice in integration in the UK and Europe. Maggie currently co-chairs the Employability and Welfare Group of the New Scots Strategy, which is Scotland's national strategy for refugees. She's worked extensively with colleagues in Europe on migrant and refugee integration and is a regular speaker at international conferences and seminars. And also given evidence to several parliamentary committees on asylum and refugee issues, and is a member of Human Rights Consortium Scotland. Maggie was recognised by our own Open University in 2010 for her contribution to the educational, social and cultural life in Scotland, with the conferring of an honorary degree, which is fantastic. And Maggie's also an alumnus of the University of Edinburgh. Our second speaker is Anna Trudgian. Anna is Operations Director of UK healthcare charity Open Road. Anna comes from a recovery background and started volunteering with Open Road 19 years ago, wanting to give something back. This became a frontline role, and Anna's never looked back from that, being a member of the senior leadership team since 2008. Now in its 31st year, Open Road's Essex and Medway teams help young people and adults on their journey to recovery from drug and alcohol addictions, plus employment, welfare and homelessness services. Their criminal justice teams support young people and vulnerable adults in Essex Police custody suites and help Medway young people as they leave prison, returning to London communities. Their Colchester and Chelmsford SOS buses help vulnerable people at weekend evenings and provide weekday welfare services throughout Essex communities. The charity works with local and national partners and funders, and clients remain at the heart of Open Road's ongoing work. So great to have both Maggie and Anna with us. And without further ado, I'll hand over to Maggie. Just a quick note that just to keep to time, when you see me pop back up, I'll switch my camera off. When you see me pop back up, you're about on your time, so I'll give you a reminder. Thanks, Maggie. Over to you.
Okay, thank you very much indeed. Assuming everyone can hear and see me. It's lovely to be back speaking at the OU, my second favourite organisation in Britain, my favourite obviously being my own organisation. I was very struck by some of Ed's comments this morning when he was talking about senior staff in the third sector having burnout and needing respite. I'm a few years away from my official retirement age, but in June of this year, at the end of June, I will, after 21 years, be standing down from Bridges and handing over to somebody with a lot more energy and a few years on me to take it forward to the next 21 years. I think, firstly, and by way of introduction, I'd like to put my remarks into two contexts. First, the operational context, and then what we might call the socio-economic context. By operational context, I mean what is Bridges' relationships with volunteers and volunteering. And we have two different types of relationships, so we're a little bit unusual from lots of third sector organisations. So the first of those relationships is, like many third sector organisations, we use volunteers in our service delivery. We have used them in the past to run volunteer mentoring programmes, specifically for young people and for women. And we currently are using volunteers from within some of the communities that we serve who have high levels of English as well as client languages. And this is mostly for outreach and recruitment and to help potential clients fully understand the services on offer, what it can do for them, and also in an initial assessment of people's needs. And we categorise people into three categories broadly. Complex, that's people with a wide variety of needs quite far from the labour market. Guidance, people who need and can use our established pathway to work or education. And resilient, people who are much closer to the labour market and who might have higher skills, especially higher language skills. The second relationship we have with volunteering, and I'm going to do volunteering in air quotes, is the service we offer clients as part of their journey to work, which is giving them the chance to undertake work placements or work shadowing in companies in the community. And that's slightly different from the more traditional role of volunteering, though we do offer volunteering opportunities with people who have a longer journey ahead of them and use it as kind of barrier removal and a way to build social connections and social bridges and build confidence. The main difference between work placements or work shadowing and volunteering is that the former, people have placements within industries that they already have a background in or links to, whereas volunteering can be more generic and is not necessarily linked to someone's former job roles or experience, and can be ideal for people who've not really ever worked in their home country. Work placements and work shadowing account for about 80% of the interventions we do with employers, and volunteering about 20%. So as you can imagine, this relationship requires a very active participation from the many employers who we work with and who have supported us over the years through a very large range of employer engagement interventions. In fact, Bridges' USP is that all of our interventions are designed with employers in mind, and many of the initiatives are co-designed with employers to ensure their buy-in. So I'll be looking then at the impact of volunteers both coming into Bridges and those going out from Bridges. So this unique relationship with the business community leads us quite nicely to the other context, the socio-economic context. And that is that we are not just in a cost of living crisis, but this crisis is coming on top of the pandemic, and that in turn is coming on top of and running alongside Brexit. A perfect storm that has disrupted those critical relationships with the business world. First of all, the impact of the pandemic on our clients was catastrophic. There was a massive lack of engagement from within the community. There was so much fear from within our beneficiaries of what was happening to families in their home countries that they had room for nothing else to think about. There is well-documented evidence of the digital poverty enjoyed or suffered, I should say, by our beneficiaries, not having the right equipment, not having the bandwidth in order to engage with online training or support. There was, as we've heard earlier today, a much higher incidence of COVID with serious implications for the sorts of people that we're supporting. And so what we saw was a massive stepping back from people who had been fairly resilient and fairly close to the labour market. Their confidence was shaken to the core. The physical opportunities to train with us and take up placements and volunteering ended almost overnight. And the impact of the pandemic on businesses was obviously no less devastating, so much so that some sectors have barely recovered, many businesses are closing, and many who haven't closed have had to make serious cuts to their service or what they do, and to staff to try and recoup the losses from the pandemic years and keep their margins up. And as I said, Brexit was happening along this, and that had an impact on us because we don't just work with forced migrants, we also work with voluntary migrants, including people from the EU. So Brexit saw more businesses closing due to lack of staff, something that we are continuing to see in the hospitality sector, the care sector and retail, which is further adding to the squeeze on opportunities that our people have to engage with employers. We have fewer clients from the EU, so our client base has changed, and there is a huge amount of confusion amongst employers about who can stay and what the legality of workers is, all of that fueled by the hostile environment coming out from the Home Office. So on top of all of that, we now have to contend with the cost of living crisis, which adds additional pressures. The cost of running a business in the current climate is crippling, and businesses are not talking to us about cost of living crisis. They're talking to us about a cost of operating crisis. So the squeeze on paid jobs, recruitment freezes amid rising costs, all eating into people's margins. There's a huge financial impact, specifically on our clients who have yet to gain leave to remain, asylum seekers, because they live on a very fixed, very limited sum of money, approximately 70% of standard state benefit, with absolutely no way for them to increase that base because working is prohibited, with a few exceptions. So they are particularly in difficulty at this time. Refugees, including resettled refugees and migrants, are also feeling stretched, either because they're on benefits, which are not going far enough, or they may be in work, but it may be part-time, it may be low paid, it may be 0 hours, or they've been put on to 0 hours contracts in the current situation. And one of the things they're struggling to do is to send remittances home, which is a major part of the contribution that all migrants make to their home countries. From refugees and migrants living in Scotland, it's estimated that around 60% of all money sent overseas from here, including overseas assistant budgets, comes from remittances. So then we come to our first contradiction. So because people are struggling financially, and may have been for some time, way since before the pandemic, people need jobs. And for the first time since the pandemic, job centres have restarted their sanctions regime, which they apply if they don't believe that people are actively looking for work. So the pressure is on. But the people we support are less ready to work now than they were. As I said, confidence levels are low, they've retreated from stronger positions, they've had no access to practical support in the labour market, and they are increasingly becoming benefit dependent, which is a relatively new thing to witness in the refugee and migrant communities. And with no or very few opportunities for us to introduce clients to employers in any practical way for over 2 years, opportunities for our people are also shrinking. And although on paper it appears there are many sectors who are desperate for staff, there is also a shrinking of the economy in other sectors, and salaries are not keeping pace with inflation, and working conditions are not always good. Many of the sectors who are looking for work, who are looking for staff just now, are promoting shift work, which usually requires access to people's own transport, because public transport does not always support a shift economy. And these jobs are not usually suited for a lot of single parents and women who make up over 50% of our client base. And on top of all that, many people who want to work and want to work quickly. So they are not interested in a period of unpaid work placements, shadowing or volunteering, even if they were widely available, even though we know that those interventions will prove to make their employment more sustainable and help address underemployment. And there is a very wide disparity amongst different groups of migrants and refugees, how they feel about placements and volunteering. Some are very keen to take any opportunity, others don't see the value at all, and that's a cultural issue. And then there's a second contradiction around supply and demand. Because people are less keen or able to volunteer, and the volunteer footprint in some areas does seem to be decreasing, it means that some businesses and many charities, as we've heard, are struggling to deliver frontline services because volunteers are drying up. In some cases, charities and businesses and services are folding, and that is leading to an overall reduction in demand for volunteers going into charities and businesses. On the other hand, elsewhere, the demand for services is on the increase because the society struggles with all these crises after another, and it's the most vulnerable in society who suffer disproportionately, who charities support. Many charities are seeing a need for their services increase, though not, interestingly, their funding. So their services demand is increasing, not just through increased demand from their own beneficiaries, but because other services have ceased altogether, meaning there is a contradictory increase in demand for volunteers. But it's sod's law that these increases and reductions don't necessarily happen in the same sectors or even in the same part of the country. And there are many other factors affecting attitudes to and opportunities for volunteering coming into businesses like ourselves. Where businesses and charities are facing financial pressures, they are often unable to pay reasonable out-of-pocket expenses to volunteers, meaning people are finding it harder to give up their time if it's going to end up costing them money. And we are very concerned that staff shortages may lead to some businesses and charities who are needing staff turning to volunteering, but in an inappropriate manner. There have been issues in Scotland of companies using volunteers to replace striking workers. This happened in Edinburgh last summer during the refuse collector strike, where, concerned with the poor optics of stinking rubbish in the streets during the international festival season, the City of Edinburgh used volunteers to clean up the streets, undermining not just the roles of the striking workers, but undermining the right to strike and also changing fundamentally the ethos of volunteering. And that's a slippery slope. When there is a risk of volunteering replacing paid jobs, the potential for the abuse of job substitution cannot be underestimated. And who is most likely to fall into that trap? Well, it's people who are not familiar with employment law and practice, people who don't know their way around the labour market, and people who don't always fully understand what is being asked of them. In other words, the very people that Bridges supports, people from overseas for whom English is a second language. Stretching volunteering or work placements to fill skill shortage gaps in a company will lead to exploitation. Of that, I'm in no doubt. Bridges spends a huge amount of time policing our own placements and shadowing and volunteering programmes to make sure they can't ever be deemed as unpaid work or job substitution. We spend a lot of time making sure our employer partners know the rules. With trusted partners with whom we've worked for over 20 years, we're confident it's not a substantial threat, but we can't be sure. So even more staff time and resource have gone into this important due diligence work, stretching even further an overstretched team of staff. We have the waiting list that Paul spoke about this morning at the top of the day. At the moment, there's 1,000 Ukrainians on one of them. And you must never underestimate the costs of good volunteer management. It takes resource to manage volunteers, either volunteering out of the company or managing volunteers who come into the company. And as funding is cut, either in real terms or through lack of year-on-year investment and increases, standards of volunteer management are at risk of dropping across the sector. It's the same for people who go into companies on work placements. Although there is no direct cost to a business working with us, there is an indirect cost in terms of human resources to manage these placements well. And many businesses just cannot take that on. So another reason why placements are shrinking. So what is behind the reduction in interest in volunteering and the difficulties volunteers face? Well, I've mentioned the potential for being out of pocket. especially in rural areas where public transport is poor and the areas to be covered are large. It usually means that the private car is essential. And fuel costs are rising, but the 45 pence a mile allowance before you're taxed on it has stayed the same for 10 years. People have less time to volunteer because as people take up more paid work to pay the bills or try to increase their hours or take on second jobs, they're no longer have the time. Very different to lockdown furlough when some people were awash with time to help out. And people's mental health is much less robust due to the stresses and changes of the last 3 years and the very real concern about money. And at Bridges, we are very, very aware of this. In fact, I'd say declining mental health of clients is one of our biggest challenges. The stress and hardship of being worried about money is exacerbated tenfold if you live far from home, unable to support those back home. Or the fear that you have attached to waiting on a decision on an asylum claim in this increasingly hostile immigration environment. Most of our clients also live in areas of high deprivation. To put that in context, 85% of our beneficiaries reside within data zones which are within the 15% most deprived in Scotland, with 25% of them within the 5% most deprived. People don't want to leave their homes. Not being able to interact during COVID has meant people have lost much of the language they gained because they're not getting the practice. They've lost their social connections. People are losing confidence, they're more fearful, they've given up hope, and they're not interested in taking responsibility for their own economic future. There is an increase in apathy, and that's easily seen through poor attendance at college or training courses. And that is not just seen in individuals, it's being seen throughout migrant communities. And partly because and fueled by the hostile environment of people by the government, people are concerned that employers are out to exploit them, misunderstanding, for example, the point of a placement or a volunteer opportunity or the financial parameters of an apprenticeship. The peer-to-peer sharing that goes on in communities, which can be so positive when things are going well, can be negative and devastatingly full of misinformation when things are going badly. And it's not the same as the pandemic. During the pandemic, there was a huge upsurge of people helping out in their communities, lots of informal volunteering, not even linked to organisations. And we might have led this to expect that this new crisis, that would continue. But the sort of issues people are facing now, the sort of help that people are needing, when it's a choice between eating and heating, is not the sort of help that generic good neighbourly support can tackle. We've gone beyond the time for picking up prescriptions, helping with practical tasks, and walking someone's dog if they're in quarantine. People's immediate crisis needs are very different. They need mental health support, financial support, debt support, financial advice and guidance, money management, in other words, specialist support. The UK's history of volunteering has meant over the years that governments have found it an easy way to underfund statutory and charitable services, assuming that volunteers will always be around. Now this is changing. I fear for the long-term impacts on the sector, just as funding for third and public sectors is being cut and cut again. So what has it meant for Bridges? Well, it's meant that being unable to rely specifically on Ukrainian volunteers sticking with us for any length of time, we've had to bite the bullet and dig into reserves to create a job share post to deal with what they were working on. As I say, we have 1,000 Ukrainians on our waiting list. We've no intention in the future, or in the near future at least, of starting up the mentoring programme, as we simply don't have the resources to run this. And this disadvantages the most vulnerable clients, especially women, and it's damaging to their ability to make valuable social connections. We're having to go back to basics with many clients, each caseworker spending longer with individuals, meaning we support less people, each intervention is costlier and more time consuming. Clients either don't want to take advantage of volunteering placements or there's less on offer. And the less migrant and refugees engage with employers in preparation for work, the less understanding there is about their issues and the opportunities they offer. Therefore, the more prejudice in the workplace increases, and the less likely it is that people from migrant and refugee backgrounds get interviews or opportunities. The employment gap between British-born and migrant workforce is growing again after a period of decline. And sadly, it all adds up to yet another perfect storm that we only hope that we can weather. Thank you.
Superb stuff. Thanks so much for that, Maggie. Covered so much ground, as Catherine said in the chat there, and so many overlapping issues. Really interesting to hear from you. So big thanks for that. We'll move swiftly on. A reminder to keep the questions coming. I see Helen's popped one in there in the chat. So yeah, we'll address those after Anna's spoken. But yeah, keep the questions coming. But I'll now hand over to Anna. Thanks, Anna.
I hope you can see that okay.
Yeah, all looks good. Thanks.
Brilliant. Thank you very much. I find that absolutely fascinating. And I feel, oh my God, how do I follow that presenter? That was absolutely amazing and real inspiration. And actually, what my presentation probably is going to do is give that more practical insight into what a smaller charity has had to deal with and some of the challenges we've had and some of the ways in which we've tried to address those challenges. But a lot of what Maggie will say, I think, as said, will also resonate through my presentation as well. But just a little bit about me, really. I come with about 25 years retail finance and was doing particularly okay. And I think my presentation's gone, has it? No.
Oh, yeah, it's just disappeared there. I don't know why that is.
I don't know. Have you got it back again or not?
Can't see at the moment. Let me hand over to our
Just disappeared.
administrative support and see if we can get it back. Heidi or Louise or anyone. Have you got?
Sure. I've got a copy here, Anna. So do you want to just maybe try sharing one more time? And if not, I can hop on and share them for you.
Yeah,
no
it did come up and then
yeah,
we love
just vanished.
technology, don't we?
I know. Sometimes Teams likes to glitch out on us.
I so love it.
There we go. That's
right.
That's
Shall we
fantastic.
try it
You can
again?
see now. Great.
Thanks,
Yeah.
thanks, Heidi.
Thanks.
Okay. So just to get back to me, I've spent nearly 25 years in retail finance, had a really reasonably good, well-paid job, and hit an absolute crux in my life where addiction played a huge part. And when such things happen, and I'm sure you've all got experience of this, it's about how do the people we support, how do we help them to rebuild their lives? But it was also about me actually coming in and volunteering. And I remember saying to them, well, I just want to give something back. I've gone through treatment and I'm doing really well. And I've got, my life seems to be getting back on track. How can what can I give back? And I remember them saying, we'd love to have you volunteering, but actually it's not just about what you can give us. It's also about what we can give to you. And so therefore, it was really about my self-worth, my esteem, and feeling belonged to. I think that was really important, and valued and invested in, that I felt, a worthwhile individual, a human being that had to contribute to society, and to feel really worthy was a huge thing and hugely important for me. And hence the reason why I feel absolutely passionate about volunteering. So a little bit about us, just to give you some context. As always, the voluntary sector, and Maggie alluded to this, is normally founded on the back of some sort of gap in services. And we were not dissimilar. So we were founded about 32 years ago. And I cannot see you, obviously, on this platform, but I'm sure you're very young and probably don't remember that 32 years ago, we had the AIDS epidemic. So just like the AIDS out of COVID, we also saw a lot of charities evolve and pick up that gap, that need to support. We're running now at about 3.5 million. And back in those 32-year days, we started with a room, a desk, and some needles in a drawer. And we would hand out new needles, and then we would collect the used needles back in. So it was around the public health aspect. And we've now developed into 3.5 million, and actually it looks like we're going to be going over 4 million this year. So we're not a huge national, but we are a community charity. And you've seen on there how many we employ, and the huge number for that amount of turnover of volunteers that we have. On average, we are supporting between probably 12.5 up to anything up to about 13,000 a year, and that is growing. But we're very much of the mind of co-locating with other organisations, because for us, our charity and the services we provide has still got a huge amount of stigma attached to it. And so co-locating with partners to break that down and to work in partnership with other providers is for us the key. So what do we sort of do today? Well, we do run addiction services, and I've just shown you some of the centres that which we run from, and that's in Essex and in Medway, both adults and young people and their families. And those centres are a variety of different locations. Some are on the high street and some are more discreetly placed. And that's really to do with perhaps some of the objections that we do get when we want to start a service. But essentially, we provide assessments, psychosocial interventions, and recovery support. However, our volunteers play a huge part in our delivery, and we have appropriate adult services. So we're working in custody suites, and that is volunteer-led. We have, as I said in the introduction, I think said about the SOS buses. And again, they do the nighttime economy, and we have volunteers going out at 10 o'clock at night to 4 in the morning. And that's truly amazing when you think of some of the stuff they have to deal with. And they are a brilliant bunch of people. A sense of humour is amazing. We also have volunteers in what we call secure settings. And that is where we work inside prisons. And we are working particularly around young people. And we are looking at bridging that gap between when they are released from prison and then try to reintegrate back into their own community. And that's just some of the volunteer projects. It just gives you a bit of an idea of the scope, I suppose, and the types that we do. In a little bit more detail, I've just listed below there, as I said, we deal with adults and young people, but hugely important to us is our peer mentors. And these are individuals with either lived or lived experience that have come back and supporting us to help deliver services. And they're great ambassadors for us. They really do challenge around our client base. And they also support with groups. They run services in the evening. They run services during the day and during the weekends in particular. Again, bridging some of those gaps where our services and our staff cannot do through lack of funds. We're also very much involved in the criminal justice. And we also have volunteers that support us in our head office function, mainly around finance, as we put on there, HR, bringing in expertise to support and help us. So how effective are we really? Well, we're running ready. If somebody comes through our door and we provide our services, we're probably running at around the 73% successful completion. That means people leave us in a planned way and go on to lead more meaningful life. Of those 73%, we also look at who is returning to treatment, because actually we could say 100% are leaving us, but actually it's about how do we sustain that. So we monitor 6 to 12 months and how many of those return. And again, we're currently running at about 5.8. That is really successful results that we're getting in. But we also, because we support the communities, we also have been able to attract funding via those sorts. And again, that's pretty useful to us in if you like, sustaining our services that we provide. I've just put this slide up really because I just wanted in all of that just to talk about, for me, the importance of volunteering. And for our charity, it's about attracting people with skills, with life experience and using them. It's about being able to support volunteers with increasing their employability prospects. I just love volunteers and their sense of humour. And, you know, we work in a very trauma-informed environment. And sometimes it's very, very difficult for our staff. I think Maggie talked about burnout. That's a real challenge for us at the moment. And our volunteers just bring that sense of humor and light relief in what can be a very, very difficult environment. But the other huge factor, when we talk about our economic side, is actually there is a calculus that you can source through, I think it's the NCVO website, and that's where you can calculate the value that our volunteers or your volunteers bring to your organization. And last year, our volunteers, look at what they brought. They brought 760,000 on a turnover of 4 million. It's not much of a calculation, is it, to work out just how valuable they are. But just like Maggie, I think I cannot do the impact of the cost of living crisis without talking somewhat about COVID. And COVID had a huge impact on our services. We were one of the few charities that were able to keep our doors open, but under very stringent NHS rules. And that meant we had to change our premises. We had to change the way we worked with clients. Masks became, and the cost of them became a day-to-day reality. And that was very difficult for us and how we normally would work with clients. But sadly, we had projects that closed down, and many of those projects were volunteer-led projects. And that took a real hammering to us, and I'll elaborate a little bit more later on that aspect of COVID. But we also saw people and our staff and volunteers coming in, and our clients coming in with more personal and mental health. We actually lost several members of staff to COVID, and that had a really profound impact. So much so that some took early retirement and some decided perhaps this wasn't the place where they wanted to volunteer or to work. And vacancy and recruitment now at the present time is a huge aspect for us to overcome. It did change our priorities, but I just wanted to say this, there was some good stuff for us. I think what COVID did do for us was to pull us screaming and dragged us into the 21st century around IT and how to use platforms such as this with our clients. And that helped us, I think, deliver the services into people's communities, into their homes, particularly with women with childcare responsibilities who didn't have to then try and drive in, and the cost of the bus that would incur. So what did we do around COVID and in between COVID and the cost of living hitting us again? We had to establish really an effective recruitment strategy. And at the heart of that, we put motivation, and we put recognizing and giving our volunteers validation when they do training courses. And we looked and we worked with our volunteers at how we could improve that. And some of that was really about just having courses advertised that they could access. It was about creating a website that was just for them so that they could share new ideas or concerns with or learnings with. It was also making sure that they were seen as a vital part of the service delivery, on par with our service users and on par with our staff. And so they very much became part of our recognition awards that we now do. I think also for us, don't underestimate the how you can support them around values. Clear lines of communication so they knew who to go to, that they felt that people were waiting for them, that they weren't just making teas and coffees, that for those that wanted, they could be a part of a much bigger profile, such as delivering groups, delivering assessments. We also looked at communication platforms, and I'm just laughing to myself when I see this and put Yammer team groups and social media. I'm probably of that older generation where, yeah, that's not so prevalent for me. I sometimes feel nothing can beat the face-to-face, but in that sort of growing environment, I recognize that this is a significant way to move. So for us, the cost of living, first and foremost, it was around financial. I mean, our utilities went up by about 70%. We couldn't negotiate a deal. I mean, any deal you could negotiate was worse than, I think, just doing nothing. But that had a huge impact on us. The mental health and the increase propensity of mental health within the workplace and within our clients. And I've just put some stark figures in there of what that looked like and what that meant for us, if you like, in terms of the impact, which was really around reducing numbers of volunteers. We had clients cancelling our DNA because they cannot afford to come on a bus. And a major part of our delivery is around groups and is around that peer support, and we were losing that. And our innovation went. We hadn't got the money to do some of the stuff that the voluntary sector do very well, of thinking outside of the box, and that old quaint saying. But we are very good at innovation. We're very good about responding to challenges and difficulties. But not having the money there really did have an impact on that. And then, of course, there was the impact to our staff. And we lost about 65% of our volunteers just for the pure fact that they couldn't afford sometimes to come into work. That worried them in terms of what we could pay them. And the budget is a budget. If we had a huge pitfall of money, that would be great, but we haven't. We had limited financial resources. And as Maggie was saying, our decreasing budget, our decreasing funding rather, was impacting on actually the real cost to us of dealing with this service. The other challenge of the cost of living was around, we saw an increase in vacancies for some of the reasons I've just explained. And we find it very difficult, and still are finding it difficult to recruit in. So therefore, we've got to cover it because there's a safety and a safeguarding issue here. And we had to cover those by employing more agencies. And for those of you that have ever employed agency costs, they are pretty high. But you had to weigh up the balance between that and having safety of the service that we delivered. And the other challenge that we had was around competitive salaries, because we weren't the only agency or the only organisation or the only sector, I think, that was struggling. But we had some of our statutory colleagues that were able to offer much more competitive salaries than we were in the voluntary sector. And there were some practices out there whereby some agencies were offering £5,000 for a staff member to go to them as a one-off bonus payment. And there's just no way we could compete and can compete with that sort of activity. We are probably fortunate, I think, in a way that nearly 86% of our turnover is commission services. So in COVID, when a lot of agencies and a lot of organisations really went to ground, they had to close because they relied so much on public support. We're not that type of charity. We're not really the charity that can go out and shake a box and get money. The public do not view us in that sort of same respect, if you like, as those that maybe provide cancer care, charities to children, or even animals. We're not that image. So we do find it difficult to get public monies on board to help us. But the chart really does show the stark reality, doesn't it, for us? If you look at the commission services, we weren't getting any increases to our funding, and the service for the costs were going up. So that middle bit, in reality, was the financial gap that we had to fill, and we had to look to fill due to this cost of living impact. It is also worth noting that to us also, alcohol of all four substances, I've seen the most increased numbers coming through. Interesting, during COVID, because the supply of Class A drugs was interfered with because nobody was on the street, and any white van that was out delivering drugs, the police were pulling them in, stopped the supply. We actually saw more people with drug-related issues come into our service, and therefore we had a huge impact on effectively discharging them out where they were not using heroin, etc. anymore. Thought that was an interesting factor of COVID. But for alcohol, it was completely the other way, and completely the other way in this cost of living crisis. I think I might be right in saying there's about 190 maybe on the conference today. And in real terms, what that 1 in 4 means, there's 45 of us at the moment in this room that are drinking at risky or high levels. I'm not going to ask you to disclose who that is. I'm just saying that's the fact in terms of the statistical information that we rely on. During 2022, that's now changed to 1 in 3. For the 47 that were in the room that would have been affected, has now risen to 63. And all of those are going to need support. All their families are going to need support, and not to mention the impact, the social and economic impact of that, and particularly around children. So what was our response? I think for us, communication was the big thing. It was key, and that's why I put it in such big letters. I think we had to bring our volunteers and our staff along with this. And so we had to make sure they were aware of what was going on and why. And so therefore, when we were changing, or when we were having to reduce projects or reduce delivery models, that they absolutely understood why. And actually, they became part of the focus group with us. And we had a lot of praise for that when we've just come through our IIV, which is a quality standard, and our IIP for staff. And staff and volunteers did praise the way in which we continue to make sure that they're part of the voice when we're making these changes. But we also had to look at the mental health of the support to the staff and volunteers, because those numbers were rising. And we talked about burnout, but there was all sort of anxiety, people not able to come into work, people being scared to come into work, people scared to go outdoors, and how they were going to live was a huge impact on how it's going to pay the bills. So we invested with volunteers that became first aid mentor and mental health mentors, and also some TRIM practitioners. And those practitioners work with our staff and volunteers that are probably exposed more to the trauma that our clients can bring to them. And that has proved extremely popular in terms of one of the ways that we've addressed that, and by reducing the number of absences that we have. We had to have a very strong financial focus, as I'm sure all of you did. So I'm probably telling you nothing new, in as much as we had an intense monitoring of the budgets. And we used to have those, I still do have Monday meetings where we're having to look at that. It's horrendous, because it's like you're looking, every penny counts. And it's not a very pleasant place, I don't think, to be able to deliver services. One of the things we did do, which may sound strange when I've just bleated about how much money we've reduced and how much costs and everything are going up, and the difference between what we're getting in and the difference between the real costs, is for us, we actually invested in a fundraiser. And that fundraiser has probably now brought in 3 times the cost to us. And what they did is they helped us track down perhaps grant maintained trusts, and provided undertook events, just other ways of which we maybe could bridge that gap. And I think that was and still is, a very worthwhile investment. We did create some online facilities. We did try the collection boxes, and really, to be fair, I think we're lucky if we got about £5,000 towards that. The other innovative, I think, idea that we did is we did look at a trading arm. And normally in the sector, the health sector that we're in, and the area within that health sector, you don't find very many of us will have trading arms. But one of the things that we noticed was that people were losing their jobs, and they were losing their jobs because the businesses just didn't understand about addiction, and didn't understand that if people get the health and support and actually are able to maintain their job, they're more likely to lead a very meaningful and sustainable recovery. So we decided to form a trading arm where we would help businesses, and we helped them with training and education. We helped them with handling those difficult conversations. And we helped them just again around the stigma of it, and to start breaking that down. And also for us, we're able now to use some of those employers to create platforms that some of our service users can apply for jobs. The other thing we did was a lot of volunteers felt, I'd like to volunteer with you, Anna, but to be fair, I don't want to go into that front line. I don't want to work with people. I'm 65, I'm 70. I don't want to get something that I'm not going to be able to recover from. I'm really, really worried about that. So we started to look at matching volunteers to roles, something we didn't do very much of. We more did about what would you like to do? And then there were the projects we had and we left them like that. But we did now start to really target around that as a way to give reassurances to our volunteers that, you know, there's something else that they could do to help the charity. We also had to look at the financial support to our staff. And, you know, we had to dig into our reserves to try and increase our salaries. We also did more practical bits around annual leave, again, looking at the mental health to give some support to them around that. And we increased our annual leave offer by 4 days a year. We gave them birthday dates and we give them a day off at shopping for Christmas. Just again, something that we felt we could do to try and motivate and to support them. With our volunteers, we did increase our expenses. We had to increase that. And we also looked at providing lunch to them and any other costs that they come to us with. We do have a hardship fund. It was something that we worked with the trustees to develop. And there's money in there that should either staff or volunteers feel that they're in a particularly difficult situation, that they then can come to us. And on a case-by-case basis, we do review that. And the last, because I can see Daniel waving to me, I just want to talk about collaboration. This was something that we did, and the collaboration was where we got other voluntary sector organisations that were in the same boat. We said, why can't we pull our cost resources together? Why can't we pull our training budgets together? And that's what we did. Why can't we pull our campaigning together? Why can't we look at our pathways to employment? And why can't we look at sharing them? And by sharing them, volunteers got different exposures to different volunteers that actually increased their employability. And so what has that meant? Well, we work with over 15 organisations at the minute. We were able to reduce our travel costs by 25% with the use of IT. That looks more likely to be 32 as we speak. But more importantly, we increased our numbers by 40% for volunteers, and we reduced our staff leaving us by 30%. And that just at the moment, as I speak, keeps the wolves at bay. Thank you very much.
Great stuff. Thanks so much, Rana. Another fantastic presentation covering so much ground. And yeah, see the claps from people. That was great. So yeah, big thanks to both Maggie and Anna for those presentations. We have had quite a bit of activity in the chat with different things. I see, Maggie, you've been kind of chipping in and answering things as we've gone along, which is great. But there were a couple of things that I thought I'd raise and just get different perspectives on, really. So there was a question, I think it was Liz raised, that Maggie responded to in terms of whether the current cost of living crisis and related aspects, as you've both spoken about in terms of COVID and other issues, whether it's a repeat of what we saw with austerity 10 years ago, where to use the words in the chat, where public services were decimated and left huge gaps for the voluntary sector to pick up, or is it worse now for those reasons? And I know, Maggie, you've already contributed a bit to that in the chat, so I'll come to you second if that's okay. I'll go to Anna first.
I was here 10 years ago, so I would say it's worse. I've never seen anything like it. I mean, it's about, no, to deal with the cost of living in financial terms is one thing. But when we're working with people, and that's what the voluntary sector do, we work with people, the impact that it's having on people's well-being is absolutely hideous. And, you know, we are having staff and volunteers come to us where they can't afford to have the electrics on or the gas on. And this is crazy. And they're out there working with vulnerable people. I think it's much worse. And I think also the way in which funding is happening is more difficult for us because there's a lot around decreasing budgets at the moment, very competitive. So VAT and inflationary increase, you're having a laugh. You cannot really apply for that. These funders, and they have challenges of their own. It's like flatlining, but our costs have gone up. I think 10 years ago there was I think there was a willingness and an ability to listen more to us and maybe respond.
Yeah, thanks, Anna. That maybe points to the fact that there was a bit of flexibility, I guess, built in because of the fact that over the previous few years there'd been an increase, and then obviously now we've got to the bottom of the barrel, and then any impact on that is even more keenly felt. Maggie, did you want to?
Yeah, I mean, when the crisis happened before, the inflation wasn't running at the rate as it's running. Inflation has not been as high since I think the 70s. And as I said in my presentation, this hasn't come on its own. It's come on the back of other debilitating things. And I can remember when it happened before, our message to clients was, look, lots of people are going to sit back on their backsides and go, well, there's no jobs, so there's no point applying. You've got a window to work really hard to get your skills upgraded, to do all the training. Placements weren't stopped. Businesses didn't close their doors. So actually, when things began to pick up after the recession, our clients hit the ground running. They were ready to go into the labour market in the way that a lot of the local Indigenous population weren't. So yeah, and the other thing this other thing that's unsettling at the moment, and not just for people who are from the Ukraine, is the situation in Ukraine. People are worried what that might lead to. You know, there's so much saber rattling going on. People are worried, how much longer is the British government going to pay out and what that's going to mean? And they're torn between thinking it's the right thing to do, but saying that my kids need to eat. Some people are worried about an escalation, that things become really bad. And when you live in Glasgow and you're 27 miles from Britain's nuclear base, I tell you, keeps you awake at night. And the whole impact, as someone said earlier today, about the impact on food poverty in the world, which is a further problem for our clients who can see their families at home really struggling and they feel in no way able to help or support. So it's a real mix of things that are contributing. So it's much, much worse. And the impacts of this will last much, much longer.
Yeah, thanks, Maggie. Some really good points there. I wanted to pick up on a question Helen's asked in the chat, and it's something that I think has been actually addressed by both of you in your presentations, but yeah, perhaps a little more insight, I guess, in terms of other organisations. There's a question from Helen that says, in the context of the challenging landscape, what suggestions would you make to other organisations to address the diverging gap of income to expenditure? Certainly, Anna, you obviously with your graph showed that very clearly. Helen goes on to say, I know so many small to medium-sized organisations whose graphs look like that. Some struggling to keep the doors open. They're pushed to the level of ultra resourcefulness, creativity, and enterprise. So I guess to apply that to both of your presentations, what do you think are the approaches that can translate, I guess, to other organisations, or whether they're really specific to your particular organisations or not?
Well, I think,
Maggie, go for it.
I think things do tend to be quite specific, but I think Anne's absolutely right that the issue around working in partnership is really, really important. And we do that too. So it's partly because we realise that not any one organisation can do everything. So the more you can work in partnership and the more you can share resources, the easier it is. It also means it can focus what you're doing. And this comes back to something that was said this morning. I think it was Paul that said it this morning about, or it might have been Ed, about not over diversifying and thinking you have to be everything to all people. And a lot of charities go down that route of developing a service because they chase the money. Oh, there's money for a thing. We don't do that thing. We could do that thing and we would get that money. And actually that's not sustainable. So when you're working in partnership, it makes you look really hard at your offer and go, we don't actually need to provide housing advice because that's not our specialty. That partner does that. That can come out of our bag, and that's something less that staff have to do. And I think it's really things like that. And I mean, it is literally coming down to things like switching the damn lights off and, you know, having an absolute kind of, you know, look at every single contract we have with suppliers for everything. And allowing, it was really quite funny. When we came back after lockdown, people were like, oh, we like to work at home. And we were going, well, if you're frontline staff, it doesn't work. It didn't work during lockdown. It can't work. So you get a little bit of working from home, but I need you all back in the office. Then when the cost of living crisis rose and people's heating bills were going up in the winter, nobody wanted to work from home. They all wanted to come into the office and use our electricity, which is absolutely fine. But, sometimes even things like saying people can work from home more often if it's going to keep costs down and whatever. And there is no easy answer, really.
No.
I mean, our core funding comes from Scottish Government and they haven't increased it in 10 years. That's a 45% reduction. And I am sick and tired of being told by funders, do more for less. Because you know what? It's not actually against the laws of physics. So what you end up doing is doing less, but more focused, I think. So it's not necessarily a worse service, it's just a more targeted service.
Yeah, thanks, Maggie. Thanks for that. Anna, do you want to comment on that?
I think everything Maggie said, I would completely agree with, and I actually covered that somewhat. I think sometimes in the voluntary sector, particularly around competitive tendering, we can be very protective, particularly of the assets of volunteers. And what that does is we put our arms and know they're mine. You are not getting them, they are mine. And I think we are a bit guilty of that. Particularly, I think competitive tendering did actually push that a little bit further. And I just think that, we're all fighting, it sometimes seems, over the same piece of meat. That's what it feels like sometimes. And I just think, who the heck is that going to benefit? Who is that going to benefit? Because it's certainly not going to benefit the voluntary sector, not for what we stand. And so therefore, for me, it's collaboration. Some of those small projects, those small voluntary organizations in our communities do such a valuable service and they're being strangled. Well, why can't some of us with a bit more behind us help and support them around managing their finances, help and support them around maybe giving them some of our funds, almost like, us becoming the funder, if you like, for want of a better way, because I think we're in real danger. So sometimes we in the voluntary sector can be a bit of a problem around that as well.
Yeah,
go on, Maggie.
Just very quickly, there was a large bit of money came to Scotland for refugee integration, and they were really keen that small refugee-led organisations got the money. But I was one of the people who assessed the applications, and we were saying, yeah, actually, some of the governance is really scary, and this is public money, and we need to be really careful. And I advocated for there being a buddying system being put in place, and said, if you give, there should be a thing that says, if you're giving money to a bigger organisation out of this fund, they must agree to spend a certain amount of that money buddying one or two small. That must be a condition of grant. And it didn't go through. And I think that should be something that actually all funders look at, no matter what sector you're in. You're a big organisation or a well-established organisation, that's fine. You're getting this money. 10% of that needs to be spent buddying up smaller organisations, even if that's just mentoring the chief exec, helping them with their budgeting. A certain amount of time needs to go into that, and then you're passing it on down. And I think it should be written into funding bids and applications. I really do. And I always think if I ever win the lottery and I set up a trust fund, that's what I'll put into my funding criteria.
I completely agree with that.
Yeah, I think you'd have a lot of people cheering that on. Yeah, definitely. I've got some space for reflections and responses in a moment, so I won't take up the time now. But we've got time for probably one more question. There was a very practical question in the chat that I wanted to just get both of your perspectives on it. You might not give a direct answer, but you might be able to forward to maybe resources to do it. It was Catherine Pestano asked the question: who's got the best deal on volunteer insurance for a smaller, under £500,000 organisation? So I don't know, either of you have a recommendation or a good place to go to get this advice, or a good organisation to go to, anything like that?
Our insurance is horrific because we've got the word asylum seekers in our memorandum and articles of association, and that panics the horses, I'm afraid. In fact, we struggled when we set up to get insurance. We really, really did. So we've got really quite high insurance premiums, and that's the reason. So I'm afraid we're not the people to ask.
And I think I'm probably going to come in on that, because our insurers see rape, pillage, murder, you name it, with our client base. And so pretty horrendous that we have. But I think if you go through the NVCO, I think they might be able to give you some advice on that. They're very, very good actually with that. And they've got a place where you can actually just email and ask questions. That's what I might have directed them there, not to our insurance companies.
Great, yeah, thanks. And I suppose give a shout out for infrastructure organisations as well. Your local infrastructure or third sector interface organisation can usually be a good resource for recommendations on policy and all that kind of stuff. So best place probably to go if you're in England is to go on the NAVCO website and have a look. And then if you're in Scotland or other regions, have a search for local infrastructure in your area. That'll be probably a good place to start. So we're bang on time. So just another huge thanks to our speakers, Maggie and Anna. Really interesting and great reflections there. So yeah, feel free to give them a clap on the reacts. I'll give a clap. There we go. A real life clap as well.
I'm sorry, I won't be able to stay for the networking if anyone wanted to chat. I have to go and meet a man from the Home Office. Never a joy, but it has to be done. And I need to leave in about 2 minutes.
Right, great. Well, wish you good luck with that, Maggie. But yeah, another big thanks. And yes, the poll's just popped up on screen for everyone as well. So if you could fill that one in, we'd be very grateful. But yeah, just a final thanks to Maggie and Anna. And yes, we'll give you a couple of moments just to fill in that poll, and then I'll give a bit of a wrap up for this session. Probably bias the poll if I can reply to it myself. Great. So yeah, just to wrap up then, it falls to me to give some reflections from a CVSL Centre for Voluntary Sector Leadership perspective on this session that we've had on volunteering, the cost of living crisis and volunteering. I think one of the things really that comes out from that is how issues of volunteering are so wrapped up in the sector and so wrapped up in other aspects of the organisations in the sector. And we heard a lot about, particularly from Maggie, about balancing that paid employment versus volunteering situation, and how at times volunteering can be seen as a replacement for paid work. And I think that points to some of the challenges that the sector faces as a whole as well, that we heard about this morning, particularly from Paul and Ed in their roles as heads of national organisations, in that the voluntary sector, if you call it the voluntary sector, is seen as being about volunteers and so being low cost or free or whatever it is, when in actual fact, as we heard from Maggie and Anna, there are big challenges about managing volunteers and the inherent costs to doing that and the implicit costs. So I think that's something that really comes through when we look at this. From a CVSL perspective, as I saw Louise, thanks, posted in the chat earlier on, we have done some work on volunteering with Volunteer Scotland, funnily enough, and helped them to produce really their own course on supporting volunteers, which is available on the Open University's Open Learn Create platform, which is a platform that any organisation can use to create your own courses and own content. And we're really happy to work with you on that if it's something you're interested in. So CVSL has done quite a bit of work on that. Carol also mentioned as well in reflections to the session that she chaired earlier, some work that's ongoing in Wales that she's involved with, the Getting Ahead Through Volunteering project with OU in Wales. So that's another thing that we're involved with, and obviously has a lot of link up with OU specific stuff, but there's quite a lot going on as well around different volunteer roles, including volunteer roles that try and link up some of the free resources that the Open University has with the sector as well. So that's quite an interesting, exciting project. In terms of general things, there's in academia, there's a sort of quite an ongoing debate, I think, about the role of volunteering and what it means, and whether it's linked to things like employment or whether it has value in itself for other reasons, intrinsic value. And there's lots of ongoing debate about that, and ongoing debates about what we should expect in terms of volunteering. So one of the things we saw from the presentations was how the cost of living crisis, the consistent message there has been a reduction in volunteering on the whole. And that's something that has been supported with academic research. But then on the flip side, we see other reports and other articles, things saying that there's been a huge increase in volunteering. And we saw that with things like mutual aid and the rise of mutual aid during COVID. We've seen that really recently with some of the stuff around the recent coronation and the figures for the Big Help Out, I think it was called, and they said I think 6 million people participated. So we have sort of asked questions about what that means, what that volunteering means there for for the organisations that are claiming that activity, and whether it has real value, and what that could mean more widely for volunteering in terms of longer term rather than the short term volunteering. So yeah, so lots of challenges really in sort of in the academic world from that kind of thing. We also saw recently, Anna mentioned NCVO a moment ago, their recent report about falling numbers of volunteering since the pandemic. And we can think about as well the general challenges that people will have during the cost of living crisis. Maggie spoke about this a lot in terms of people having less capacity, having more challenges in their life, which means they're less likely to access services that actually are intended to improve their lives. So it's a double whammy there, which can be really problematic. One of the things I wanted to link back into some of the other presentations from earlier today, and as Maggie mentioned, Ed and Paul spoke quite a bit about volunteering. One of the things that was mentioned in that first session was how funding cuts to organisations in the sector leads to, I think it was Ed said, leads to them becoming more voluntary, i.e. they had to have money to pay staff, so they rely more on volunteers. And I think that's sort of a tricky balance really when it comes to some of the reflections that Maggie gave us in terms of the staff versus volunteer roles. So something to think about, I think. Yes, I'm just looking at my notes here. I've already mentioned Carol's role. I think there's something really great in what was the sort of final point of discussion around collaboration. It's something that we emphasize a lot in CVSL, and certainly a lot of the work that I've done in the past, that Carol's done. Fidèle talks a lot about collaboration. So it's really running through the heart of what we talk about at CVSL. And I think there was a distinction in this session to the earlier sessions, whereby we heard about pro bono support, often from the private sector, from businesses, etc., coming into the voluntary sector and giving that expertise and support around ways of working for organisations, which can work. It can work. It can be a good approach. My personal view would be perhaps there can sometimes be value contrast there, and then value conflicts between those two different approaches. I know, so from my own view, it's really heartening to hear about this collaboration that goes on within the sector, and the idea that Maggie said about having larger organisations formally in funding bids, that having the need to support smaller organisations. I think that's really heartening, and I think that points to a sector that is collaborative rather than, as Anna pointed out, one that historically, certainly in the last 10-15 years, has been pushed towards this idea of competition, particularly for funding and particularly in contracting and tendering for projects. So I guess if we personally, I sort of see that as the future of the sector, really. If we can improve that and increase that, I think that could lead to really good things. And part of that obviously is about volunteering and trying to get the right people involved in the right way. And yeah, so lots of opportunities, lots of challenges certainly that exist. CVSL, we obviously maintain an interest in the sector generally, in volunteering specifically, and we'll continue to do more work on that. So I think that's about it from me. It's enough waffling on from me. The next part of the day is going to be some closing observations from Fidèle, who's the director of CVSL, just to close this section of the conference. We'll then have a short break, and then we'll have our facilitated networking. So make sure you come back for that, because it's going to be hosted by Francesca, our colleague, who's fantastic, and yeah, we'll be around for that. So if you're interested in discussing some of these things further, or discussing the cost of living impact on organisations, which was the first session, or the second session, which was focused more on sort of the qualities in different communities, yeah, by all means, come along to that. Should be a great session. And that's it from me. I'll hand over to Fidèle. Thanks, Fidèle.
Thank you, Daniel, and thanks to the whole team who actually worked behind the scenes to get this event going. And maybe that's where I should start by saying some thank yous to some people who have been working in the background. I'm very sure most of us have heard from Heidi, who was our conference organizer, who did the production and everything. So thank you very much, Heidi. So we should, everybody should clap their hands for coming up and developing such an interesting session, which I hope everybody enjoyed. I would like to shout out for my colleagues Louise and Sam, who have been also behind the scenes. It would not have happened without them being there and digging us out and making sure that everything was in order, making sure I was sitting in the right place, find a place where there's not a lot of background noise behind me. It's not my office, by the way. You'll see me in the office when we have a networking session. And also my colleagues, Daniel and Carol, for doing such a fantastic job of not only facilitating sessions, but also making sure that everything ran very smoothly. But we could not have done it without our speakers. Some of them are still here. So those who are still here, thank you very much for your contribution and your time. It is highly appreciated. We could not have done it without you. And then our great audience. So when we set out to start, we were not sure how many people are going to come and how many people are going to literally move from registering to actually coming on the day. So thank you very much for those who managed to make it, attend most of the day or part of the day, and we hope we'll do a proper thank you on the other side when we have a networking session, when you'll be able to open your mics and contribute and talk to us. We are not robots and you are not robots, and then we can have a proper discussion. So I'll be looking back at the whole day, but before I do that, let me look at some of the things which I've been instructed to do. I have my list here from the taskmaster, who remain nameless. So we have been running polls throughout the day. So they are all accessible if you use the polls function at the very top of your screen, not too far away from, more or less in the middle. So have a look and have a go. So because we'd like to hear from you, we look forward to welcoming you back again at 15:15 when we have an interactive session which our colleague Francesca has been preparing for. So don't let us down, because otherwise it will only be me and the team sitting down, which is not going to be great, because we need to engage and hear from you. And maybe we can have some answers to some of the questions which came up, for which we didn't have the answers, so we can continue. We are aware that some people might have school runs. So obviously, if you have a school run, by all means, you have to go and attend to those essential activities, family activities. And remember, the session we have later is just informal. There is a survey coming up, in the following days. Please complete it and return it to us. We would highly appreciate. And we can only host those events if we are making a difference. So the feedback we get is very important, because, for example, the feedback we received last year shaped the event we have today. Because last year we had an event in the morning, plenary session, and then we had workshops in the afternoon. Then we realized our people disappeared in the afternoon. So as a result, we had to do something, and that's why we came up with a format where we have got keynote speakers across the day, and then instead of CVSL and the Open University giving a presentation on what we do, we talk about what we do in our feedback session to the presentations. We are still tweeting, if you can, at OUB School, and then the hashtags are CVSLConf 2023 and cost of living. And in order to keep in touch with us, we encourage you to sign up to the CVSL newsletter if you have not done so already. So again, it's a way of keeping in touch and knowing what you are doing, and also you talking to us and telling us what you are doing. And we didn't get a chance to go around flagging all the things we do. But for example, we have got a blog on our website, which we would welcome actually people to write their blogs and publishing them. It doesn't have to be people from the OU. We know wisdom is good when it is shared, and we don't have all the answers, but collectively we have got nearly all the answers. Because that's the housekeeping order, and then you can register. If you have not registered for the mailing list, you can do it via the email address, which was okay. So it is actually being posted in the chat, so you know. Okay, so now before I finish, I will do very quickly go through the day very quickly, because I know you know, we have been listening for too long. We don't want to hold you longer than necessary, but I've been taking notes to see, you know, to hear what people had to say. But one of the key messages I'm getting from the day is that we have to be careful as a sector, that's the voluntary sector, to ensure that not only we deal with the symptoms of or i.e. the presenting issues, but also pay attention to the root causes of the wicked issues behind those symptoms. Because if we only treat the symptoms, we are not going to address the problem, and the problem will stay here and will be with us for a long time. So we are also told that the voluntary sector, similar to the businesses, should be allowed to fail. You can't just, you know, expect all the voluntary sector organization to come up and do all the good things without any risk of failing. So failure should be allowed, and people who fail should not be vilified, because when they come in, they have good intentions. And as people said earlier, some of the business ventures fail, and when they fail as long as they don't take people with them down the cleaners. But you know, the voluntary sector should also be allowed to be what it is. We had a good debate around the whole idea of restricted and non-restricted funding, and whether or not the voluntary sector organization should be involved in commissioning, and how do they actually balance their books. Should they go for contracts by the government? And if they do it, then will they compromise their voice? But if they don't do it, then who is going to do the service, and who's going to pay for the service? Because we know that money is finite. We certainly, although COVID was not on the menu, as one would say, it is something which came up across the day. And literally the cost of living is coming on the foot of, in the back of the COVID-19 pandemic, with all the inequalities it exposed. And so those things came up very strongly during the day. There was a big debate around funding big organizations, and whether or not the small organizations should be funded. It's interesting that Maggie, in her closing remarks, was talking about, you know, maybe there should be something around encouraging big organizations to buddy or mentor the small organization to help them to build the capacity in order for them to access resources. But certainly there was an urge to invest in small organizations rather than just focusing on the big organizations. We had a discussion around co-production and lived experience, and I'm very sure that's something we can talk about when we are having informal networking, because I know we as academics, we are being told now that we have to be involved in co-production, but what does it mean? Are we talking about people who are equal, who generate the knowledge? Does the knowledge belong to the community, or the person who does the research and then goes and write up about what was uncovered? We spent also some time talking about some of the taboo subjects, including domestic violence, and how the cost of living crisis is impacting on their services. We discussed issues around asylum seekers and how they are getting just a small fraction of the money which other people on benefits get. And the volunteers, I think there was this debate whether or not the volunteers, the numbers are increasing or decreasing. And it was interesting that Maggie was talking about Bridges program having a waiting list of people who would like to volunteer, whereas Anna, for example, was talking about not having enough volunteers. So the only problem is they can be available in one place, and not necessarily in the other, and they may not have the skills we need. So there is an increase in demand for voluntary sector, with obviously shrinking resources. And what was interesting, and I found actually disheartening, is the fact that some people are no longer able to volunteer because they can't afford to pay the transport expenses, or have had to take up a second job, or have had to increase their hours just because they have to find a way to pay their way around the cost of living crisis. So it is, so what we had today is a lot of information, which I hope you'll go and take and use. And there is always a risk of volunteers being expected to replace the employees. And yes, you can be a volunteer, you can go and acquire the skills you need for employability, but at the same time, we should make sure that those volunteers are not exploited. And I have seen situations where volunteers are actually taken for granted, so they expect to do the job which somebody else should be paid for. So volunteers are giving their time, they're giving their, so we have to take it on face value, and we should avoid the risk of, burdening them unnecessarily just because of, the need, which may be increasing. So if we have the resources, let's pay people and then use the volunteers just because we need to use them and because they are available, rather than abusing their availability and all the things said earlier. So I liked the idea of validating the volunteers, because through helping them to access courses, creating spaces for them, and seeing them as part of the delivery of services. That's something I feel very strongly about, and it's something which I have seen actually in action, where some of the services I have been involved in delivering for the voluntary sector, not necessarily here, would not have been delivered without the volunteers. And I was also reminded that volunteering is not just something around going to the kitchen and making a pot of tea or coffee. So it's more than that. And I think if volunteers are coming in, you have also to help them to develop as people, develop skills, and also use the skills if they have them already. So there were some worrying things said, including, for example, the increase in alcohol abuse, because of lockdown, but obviously the cost of living crisis. So there are a few things we have to look to and explore what we can do within our own means to address them. In rounding up, obviously, one of the things which I learned, which may make sense, is the voluntary sector setting up trading arms as a way of diversification of their funding sources. But obviously, we have to be careful that those organizations don't become money driven, that some of the things which they do best are abandoned in the pursuit of money. Liked the idea of having some hardship fund. I wish we should have them wherever possible. And finally, one of the things which was said were the partnership and the collaboration, and why we need to work together to deal with the challenges we face, including the recruitment of volunteers, sharing services, and decreasing costs. And we had a very good demonstration of how big a difference sharing resources, collaboration, and partnership can make. So all in all, I think it was a great event. I hope everybody will agree with us. But we don't want to drum our own trumpet. We want to hear from you. So we are keen to hear from you when you complete your evaluation forms and send them in. And we will be asking you a few questions on the form, but it will be straightforward. And we are delighted to have you on board. And we look forward to seeing you in 15 minutes. So, thank you very much for listening. Thank you for your time. Those who are able to stay, hang around. We see you in 15 minutes, and I'll go and change the setting and go somewhere where there is a bit of life, because it will be informal. So on this note, thank you and see you shortly.